My name is Peggy Schubert. I am a benefits consultant with Gallagher Benefits, a global HR benefits consulting firm. So in terms of employers in this immediate greater Philadelphia area, we have probably between 400 to 500 employers, which probably represents a couple 100,000 employees in the Pennsylvania, New Jersey region. As a member of the Greater Philadelphia Coalition, I see a tremendous amount of value, including the wonderful education programs that are conducted by the Greater Philadelphia Coalition, including annual conferences on a variety of topics, as well as the annual Wellness and Wellbeing Conference. There are special conferences that we recently did on cancer. Others have been on mental health. Many of the key topics that are important to both us as consultants as well as to our employer populations are presented by the coalition. So that's one key value. The other is really just the commitment that the coalition has to improving the health and well-being of the community. And I think that's really important, that we live in a thriving, healthy environment, and the coalition has wide-reaching opportunities to improve that, and employers benefit from that as well as consulting firms. So in terms of benefits consulting, that is a different avenue. What we're doing with our individual clients is really helping them with their strategies for their employee benefits and rewards programs. We're helping them plan both immediate and long-term actions. We're helping them with their designs of their actual programs, looking at their data in terms of their population, trying to understand what are the real drivers of the health problems that may be in that population. We do all the financial analysis of the programs and the cost, helping them choose the right vendors that are for them. Important, which is a variety. That's why, hopefully we do have a lot of different vendors in the marketplace. We do all the communications for them, as well as help them with some basic legal compliance issues. I think it's complementary in several ways. One, first off, as an advocacy for the employer. That is really the beauty of this coalition, where it's enabled employers to come together, and through that ability to join together to emphasize their power of their voice. And as a benefits consultant, we are always advocating for the behalf of our employers, as well as making sure that, whether it's the healthcare providers in the community or the carriers in the community, are really acting in their best interest. And I see the coalition with those same goals, and together, we're able to really accomplish a lot more. As a benefits consultant, we are always looking to improve the education avenues for our clients, and certainly the coalition, through its many programs, helps those employers to see that. It gives them the opportunity to discuss with other employers. Sometimes they feel very isolated in viewing their particular program, and it's nice to have that avenue to be able to talk to other employers and find out what their problems, what their similarities, and what their differences are. So I think that's really helps those together. And then I think the other issue that we have is improving overall quality, and I think the coalition has a great deal of emphasis around quality, finding the right care at the right time with the right providers. And I think the work that the coalition has done with Leapfrog, building that health and safety into the community, getting those providers to participate in that, certainly enables us then to use that information to encourage our employees in our employers to make sure that they seek that quality care. For me, the coalition, I've been in consulting for probably 30 plus years. And I remember always in this Philadelphia region, although I've done many assignments and have national employers and global employers. But Philadelphia, before the coalition, was always very fragmented. We often felt that there was not really the strong representation that the carriers or the vendors were necessarily heeding, or the providers were necessarily heeding the voice of an individual employer. So with the coalition, I think it's It's really brought together kind of the fabric of the community, having employers participate in that, giving them that power to, through the coalition, to kind of voice their concerns. I think that, that is a wonderful being also a part of the national coalition, again, gives them those avenues and has really made a difference, I think, to the health and well-being. What I hope is that we continue to grow and that more and more employers do join us and feel the benefits that they receive. So much value is available through the coalition, just the educational opportunities and that ability to connect and have a voice is, I think, well worth the involvement that an employer can have in the coalition.